Hi, I'm Kayla Garrett, the Vice President of Pinnacle Care, Oklahoma. Today we wanted to talk to you guys a little bit about mental health. Many people don't realize that there is a major association between mental health and diabetes. 1 in 5 diabetics will develop a mental health disorder at some point. There are many issues that a diabetic faces. Just the diagnosis alone can be psychologically distressing. Depression caused by the stress of obtaining care, receiving new education, learning to self-manage a new lifestyle, the economic hardships, fears of complications. This can all cause you to feel helpless and hopeless and cause depression to set in. Depression and anxiety go hand in hand. Generalized anxiety disorders and related conditions like PTSD, social phobias, OCD, and body dysmorphia are all common among diabetics who suffer from anxiety. Diabetics also have a higher rate of suffering from an eating disorder. Anorexia, bulimia, binge eating disorder, night eating syndrome are all common in diabetics, which is so dangerous because healthy eating habits play a major role in managing diabetes. Getting a mental health screening regularly is a great way to stay on top of mental health. If there are any signs of mental illness, treatment should be pursued quickly. Therapy, support groups, meditation, and exercise have been shown to be extremely effective at treating mental and physical challenges that diabetics face. At Pinnacle Care, we believe a person is a whole, mind, body, and spirit. So if we can improve the mental health of a person, we can't help but improve the physical health of a person.
Hello everyone. I wanted to thank you for the opportunity to speak today. I'd like to take a moment to introduce myself. My name is Joe Etherly. I am a licensed professional counselor in the state of Oklahoma. I work with Pinnacle Care and the great team there. I've been working in the field since about 2008. I completed my bachelor's and master's degree at East Central University in Ada, Oklahoma. And I grew up in a small town near there, Stratford, Oklahoma. I've worked and I've served in these rural communities, grew up in these rural communities. I've also worked and served in the metropolitan communities, Oklahoma City, Norman area. And I've worked with a wide array of folks. I've worked with ages 0 to 3 in the early attachment issues, up to ages 93, maybe a little bit older than that. But really, one thing that I have found that impacts us, regardless of age or location or socioeconomic status or gender or any of those cultural differences, is trauma. Trauma is something that is a human experience, and it impacts us on a deep level, often in a way more than we realize. I'd like to discuss with you all today the impact that chronic trauma, especially chronic childhood trauma, has on diabetes, both type 1 and type 2. I'm going to talk a little bit about how chronic childhood trauma can contribute to the development of type 1 diabetes, and a little bit more about how chronic stress can contribute to the onset of type 2 diabetes even later on in adulthood. So I'd like to share with you a short video on ACEs, or adverse childhood experiences. And then we will discuss the impact of ACEs on the development of diabetes.
What does your parents' divorce have to do with your risk for heart disease? If your mother had a drinking problem when you were growing up, are you more likely to suffer from depression as an adult? Here's what you should know about ACEs. ACEs stand for Adverse Childhood Experiences. extremely stressful events that can happen to a child growing up. Some experiences are so stressful that they can alter brain development, as well as the immune system, increasing the risk of lifelong health and social problems in adulthood. The term comes from the Adverse Childhood Experiences Study, landmark research that shed new light on the root cause of everything from stroke and liver disease to substance abuse and mental illness. In the late 1990s, an epidemiologist from the Centers for Disease Control and a preventive medicine doctor at Kaiser Permanente set out to understand the association between childhood experience and lifelong health. They asked over 17,000 people in the Kaiser Health Plan in San Diego about their health history, as well as difficult questions about their experiences growing up. Anda and Felitti tallied up 10 different kinds of adversity in this largely middle-class and college-educated population. They were stunned to see how common ACEs were. 21% of all respondents were sexually abused as children. 19% grew up with someone who suffered mental illness. 28% had been physically abused. And 2 out of 3 respondents had experienced at least one ACE. The researchers next looked at how someone's ACE score, or the number of adversities they experienced, related to a wide array of serious health and social problems. They saw that the more ACEs someone had, the greater their risk for poor outcomes compared with someone with no ACEs. Someone with an ACE score of 4 had twice the risk of heart disease and cancer. Someone with an ACE score of 5 had an 8 times greater chance of being an alcoholic. And those with an ACE score of 6 or more, on average, died 20 years earlier. With every major problem they looked at in the ACE study, the risk went up for each additional adverse experience in childhood. As Dr. Robert Anda says, what's predictable is preventable. It's important to remember that ACEs are not destiny. ACEs are a tool for understanding the health of a population as a whole. For individuals, an ACE score can be a tool for understanding their own risk for health and social problems, and empower them to make changes for themselves and their children. ACEs tend to get passed down from generation to generation and are common across all income levels, races, and cultures. But increasingly, people of all different professions and backgrounds are coming together to discuss how ACEs affect their communities. They're finding new ways to treat and prevent ACEs. Many doctors are starting to screen their patients for ACEs as part of their medical history. More schools are becoming trauma-informed, considering the source of problem behavior when disciplining their students, instead of immediately suspending or expelling them. To learn more about interrupting the cycle of adversity and improving health and well-being for the next generation, please visit kpjrfilms.co.
Diabetologia, a .com research website, found that children, regardless of weight, whether they were overweight or not, if they had experienced a stressful traumatic event, such as the loss of a parent, death in the family, parental divorce, abuse, any of those things, they were 3 times more likely to develop type 1 diabetes. And the interesting thing about type 1 diabetes, it had previously been considered primarily a genetically driven genetic response. But what they found is despite any previous familial history of type 1 diabetes, the exposure to the stressful traumatic event prior to age 14 increased that risk threefold. And so it being an autoimmune disease, it destroys the insulin producing cells. As we saw in the ACE video, this is just another way that trauma has a physiological impact on us. There's different thoughts as to why autoimmune diseases tend to increase with trauma. Some view it as being related to how trauma is stored in the body physiologically, and the body responding and seeing it as a foreign body, and so thus the body in essence attacking itself. There's some debate as to if that's the case or not, but whether the causation, we see the correlation. On a probably more common note, when it comes to chronic stress exposure, then we get to talking about the impacts on type 2 diabetes development and insulin resistance. And when we talk about stress, everybody goes through stress, and there's really three types of stress. Eustress, which is I refer to that as useful stress. These are the good things in life that are a little bit stressful. You may be getting married or starting a new job or things like that. Graduating. Then there's the day-to-day life stressors, bills, changing jobs, maybe not getting a better job, but changing jobs, moving, life stressors, and then there's traumatic, stressful events, and these are things that are, I say too much, too soon, too fast, and that's really relative to the person. What may be a traumatic event for one person may not be experienced as a traumatic event for another person. But the reality is that when we are under stress, and especially chronic stress, our bodies produce a lot of chemicals to keep us going. One of those is cortisol. And cortisol, as we experience stress, cortisol, it is a excitatory hormone. It keeps us going, but it reduces insulin production, and it also reduces the cell's availability to uptake insulin, and so what was a door in the human cell that allowed insulin to pass through as needed is now a wall, because the cortisol in a sense have hardened off those pathways. They've blocked them, and the longer we're under stress, the more cortisol we produce, the more we are fatigued, the more we rely on sugars and coffees and stimulants to keep us going, which in turn wears on the body and creates more stress and more cortisol and insulin resistance. And it becomes this vicious cycle of stress, body's attempt to manage that stress. And the byproduct long term is serious problems with the body's ability to manage glucose and insulin. And then, when we talk about trauma and experiencing stress. The reality is, when we are able to eat, when we create saliva in our mouth, whether it be through eating food, chewing gum, drinking, smoking cigarettes, all of these things create salivation in the mouth. When we create salivation, when we create saliva in our mouth, we're turning on our digestive system. Our digestive system can't be on our digestive system cannot be off if we have saliva in our mouth. And the fun fact is, when we are in a fight or flight mode, our digestive system turns off. It can't be on and us be in fight or flight mode. So the trick in there is that oftentimes we attempt to turn our fight and flight mode off by producing saliva in our mouth, which turns our digestive system on, which turns our fight and flight system down. It's what we call comfort food. We do it because it has a physiological response. But when we do that, our body's ability to process that material is compromised because of the stress hormones. Other hormones besides cortisol, but cortisol being one of the primary culprits in this issue. It really creates a toxic environment inside of our bodies. And so I guess all of that to say, if we're treating diabetes and we're not treating stress, chronic stress, traumatic stress, we may be putting the cart before the horse. And I would encourage us all to consider the impact of stress on our day-to-day lives, the impact of traumatic stress on our entire life. And if you need someone to talk to, if you need someone to help, if you have been carrying a heavy load for a long time, I encourage you to find someone. Find someone that can help you loosen that load. Thank you.
The old adage about you have to be overweight or obese to be a diabetic. Wrong. You got to be unhealthy, not eat right, not stick to a regular diet. Wrong. I am kind of prejudiced when it comes to food. I try to stay a lot away from a lot of white things, only because I know that they cause issues, a lot of weight gain. And yeah, I be the first one to admit it. I'm vain. So I like to look decent. I like to feel decent. And I never had an inkling I had diabetes. There was no way. The reason why was because I was so high on sugar that I was like the engine that could, always going and going. I never ran out of steam. So how it affects me today, I listen to my body when I didn't pay attention before. The itty bitty little tiny sweat beads that you get up here, the glistening skin, the clammy feel. It's not sexy. And on top of that, to be now 47 years old, thinking about the things that happen to women, sorry ladies, our libido. We go through menopause. What is that? And you think about all of the things that your body is changing into and morphosizing into, and you've turned into this crazy woman who wakes up in the middle of the night and you're sweating to death. And then you think, oh, wait, is that a night sweat or is my sugar out of control? No. These are the things that run through my mind and my body all day long. And for some people, their libido, crash. Others, totally different story. Take out the libi and the I do, okay? So it's affected me in so many negative ways. I think to myself, okay, single lady, doing her thing. I'm going to go meet somebody and I got to make sure, oh crap, did I take my insulin? Do I have insulin with me in the car? I know that I keep Nutter Butters in the glove box. I wear a sensor on my arm so that people don't get fearful of me pricking my finger. A lot of people look at my sensor on my arm and they want to know what it is. I give them an education 101. This is the problem. Nobody talks about the side effects and the way it affects other people. I worry constantly about my children because the first thing that flashed in my mind about my A1C when I read that lab report was my grandmother, my biological grandmother on my father. I remember her lifting up her shirt, and she was kind of a heavy-set woman. She had these small bruises all over her stomach. And I used to watch her give shots and think, oh my God, is that so painful? Ugh, I never want to be like that. And then I saw her later in life because, of course, things happen. You heard the biological part, right? I saw her later in life and almost blind, one leg missing. So these things are here. So I always make sure that I'm paying attention to my mind. I'm paying attention to my body and what it's telling me. Signs and symptoms. Going too much all the time, not paying attention to your diet, I'm not going to live fearful. I'm going to live free, but I'm also going to pay attention, which is what we have to do. We have to pay attention to our loved ones. We have to pay attention to heredity. I can't even imagine how adoptive or outside of just being a human being, we don't know about heredity. We don't keep in contact with genealogy and things of our ancestors. So those things need to be addressed. And it's not exactly like I want to go out on a blind date with somebody and say, oh, gee, by the way, if my breath smells a little fruity and I got little sweat beads on my forehead, I'm probably low on sugar, so you mind helping me out? That's real sexy. He's coming back for a second day, right? Be mindful. Be careful. And pay attention to your bodies. That's all. And I hope somebody out there with diabetes knows that it's not a death sentence. It's an awakening. For us to pay attention to us, finally. Don't be so busy that you forget about you.